Good afternoon to all the dear participants. Today we are very happy to have Dr. Tejaswi Rao ma'am with us to discuss a very important topic, brain tumors spot it early. Dr. Tejaswi Rao ma'am, please take over the section.
Thank you so much for this warm welcome. So today I'm here to discuss a webinar on a topic of brain tumor because it's one of the scariest part of a diagnosis that a human being can get, that to a most mysterious organ which is brain. So I'm Dr. Tejaswi, consultant neurologist, DRNB Neurology, MD General Medicine. So let's discuss what is the fear and why, what is actually the reality. So, not all tumors are cancerous. This is something that everybody should know and be aware of. And if detected in the right time, just like any other organ tumor of the body, so is the brain. It also can be treatable. Brain actually adjusts very quietly, and more often than not, because of the auto regulation and the neuroplasticity, early symptoms may be very subtle. Hence, the compensation of this neuroplasticity will make it very difficult for us to identify in an early stage. Which is why this webinar, which is why the need for awareness is more important, because very high level of suspicion is needed to identify a brain tumor in an early stage. And just as any other tumor, if identified early, definitely it can be treatable, in most cases manageable with the best output. But the cooperation from the patient himself is also equally important for us to identify it early. So, what exactly is a brain tumor? As tumor word says, it's an abnormal growth within the brain because it's brain tumor. So, this can be malignant, that is a cancerous variant, and can be benign, which is non-cancerous variant. Even small ones, any small growth also can cause pressure in the brain because brain is a closed cavity. It lives inside a hard skull. So like a computer inside a case, so any extra growth or any swelling in any small area or a large area will obviously increase the pressure inside the brain, hence disrupting the normal function. So it's more often the site of the tumor matters than the size of the tumor, because sometimes if the tumor is very much in a wide area, until it grows to a certain extent, we don't usually see the symptoms. So that is more dangerous. So it is the symptoms earlier will also define that the site of the symptom, site of the tumor is different, and symptom late will actually give us an idea that tumor has been sitting there for a while. So, like any other tumor, this does not follow the body rules because it's not the size, it's the position matters, and the function of the brain that is being compromised by this tumor is what matters. So, amongst brain tumors, what are the types of tumors and how do we identify or name them? So, this is a picture of a neuron. Each and every part of the brain starts with something like this, which is a neuron cell body, and the nerves travel across the axon and then supply to the various parts of the body. So, any excess growth of different parts of the body will end up in different types of tumor. So also different sites of tumor. So this is a picture depicting that site of the tumor can be in various places. Like you can see, parasagittal tumors can usually be unnoticed for a very long time. But supracellular tumors or foramen magnum tumors, they are in a very critical area where even the minor growth will somehow show us some minor clues, because they are in a very vital and most important sense organ, supply related nerves area. So, site of tumor may vary according to where it is coming from and what type of cell it is coming from. Another picture, this is a astrocytoma, so nothing but an excessive abnormal growth of an astrocyte. So it can be a small area dysfunction of astrocytes which turns into astrocytoma, and hence it can grow over the years and disrupt the area of the brain which was actually normally functioning, but now it doesn't function normally because of the pressure given by this tumor. So among the brain tumor, like we discussed, it could be primary and secondary. We discussed primary, that is benign non-cancerous, malignant cancerous. But the secondary type of tumors are also possible in brain. That is nothing but any tumor of the breast or lungs or even the spine, our backbone, or any such tumors can easily travel through the blood and reach the brain and deposit their metastasis in the brain. So both type of tumors are possible, and secondary tumors are much difficult to treat because the primary organ is already involved. And amongst the primary, malignant are something which we actually fear. So why early detection matters? Because smaller tumor is obviously by default easier to manage and less damage of the surrounding brain tissue, better recovery, less disability to live with because lesser surrounding damage, lesser disability to live with, and hence lower risk of complication. Easier management because as the complications are low, we have a very wide range of possible treatments and the safer ones when it is in an earlier stage. Because our goal is not to wait for the crisis to happen and fear when it will happen each and every day, live with fear, but to recognize the subtle signs with your help, definitely, and identify and treat it as soon as possible and live like a normal, a non brain tumor related people, just as normal as they do. So, what are the top early symptoms which people usually ignore, but which I really want to stress upon because this is the only way we can identify the tumors earliest and treat them and live a tumor free life without any disability. So, first is headache, just not any regular headaches, but the one that persists every day, worsens in the morning, and progresses over a period of time, improves after a severe projectile vomiting associated with vomitings for that matter, and it increases when we are having a cough or we are bending forward because this increases the pressure in the brain. So if there is already increased pressure and by coughing we are increasing further pressure, definitely it's going to cause a headache. So that is the clue which we get if you have this particular type of headache. And if you anybody will have a regular pattern of headaches that they get when they are sleepless or when they are under a lot of pressure or stress, but if you notice a change in a character or a pattern of your regular headache, that itself is a time when you need to go and check it out. Second symptom is visual changes. It can be blurred vision, it can be one eye, it can be both the eyes, it can be double vision, losing focus, or decreased contrast of colors in one eye vision. Excuse me, new sudden bumping into things where there sometimes insight may be present, sometimes insight may be absent. Insight meaning you being aware that you are not able to see. Sometimes insight may not be there. So people do bump into things, give us random explanations about why they bumped because they themselves will not understand that they are blind, but they actually are. So this is a function of an occipital lobe. Even in familiar places, if you're bumping, it is not normal. So this happens only if the optic nerve that is coming to the eye is being pressed or itself is the origin of the tumor or there is a tumor in the pathway of the vision. Third, seizures. Any person who's not a known seizure since childhood or since birth suddenly has a seizure now. Usually, this is the first sign in adults. That is when we diagnose most of the tumors. But it is more often than not, it is already crossed that early phase or early stage of tumors. Fourth, unexplained personality or behavior changes. Suddenly becoming irritable, the whole a calmer person becoming irritable, a very what do you say, short to temper person becoming very withdrawn and calm. So any change in their regular behavior pattern, confused, forgetful, overly emotional, excessive crying to normal situations, excessive laughing to normal situations, withdrawn, and overall just not themselves. This kind of symptom is usually noticed by the family member than the patient themselves. And like all other symptoms, pressure can affect why should they have this? So pressure can affect the personality or behavior related area of the brain, hence the symptom. Fifth, weakness or numbness. So, just like how we see a stroke patient, particular damage of a particular area because of another reason, if the same area of the walking and sensations and motor functions is affected or pressed by a tumor in the adjacent area, well, this definitely will result in a stroke like picture. However, it will be very slow and progressive. It will worsen over days to weeks to months. Unlike stroke, which happens in a matter of minutes or seconds, there will be unsteady gait, and elderly people now having sudden onset of imbalance without an ear problem is more often than not a paraneoplastic. That is nothing but uh, non-brain tumor, but brain nerves are affected because of an another body associated tumor. So even such situations we identify the primary tumor because of this new symptom. Fifth, speech, trouble speaking, being gibberish, loss of absolute sound, or difficulty understanding. So, these are the common symptoms which are very important to understand, and the difference between this particular symptom in a brain tumor versus this symptom in a stroke or otherwise. So, noticing each and every minor detail in a patient who was otherwise normal is important to be diagnosed in the earliest phase of brain tumor. So, when to get it scanned? So, like all tumors, tumors are graded over the stages. So, stage 1 is benign, stage 2 is low grade, but however, there is a slight chance of becoming malignant. Stage 3 are definite malignant. Stage 4 is usually very malignant and it may cross beyond that particular organ. This is a gross generalized statement. It does vary from tumor to tumor. So, it's better to identify between stage 1 and 2, because once it goes to stage 3 and 4, it is definitely going to leave some lasting damage. So when do we get an MRI? If the symptoms that we discussed are persisting day by day in spite of medications, the symptomatic medications, being progressive over the next few weeks to months, and there's something new which didn't happen before and they're unexplainable, that is the time you get an MRI, because MRI is the first and the most basic thing which can identify a brain tumor. It is just the starting. So do not fear getting an MRI, because MRI is safe, radiation free, it's painless, and it gives a clear picture of possible what it could be. However, once we identify the site and size of a tumor, there are much more things to understand what exactly is the type of tumor and what is the stage of the tumor. But at least to identify that it exists, we are only going to depend on the basic MRI. So this is a gross picture of how a scan looks in a different various types of MRI. The right bright green picture is actually perfusion scan, where red is showing very excessive activity. That is nothing but because the tumor cells are taking up all the energy and they are excessively active. So that area of the brain will appear red, like overactive, because it's consuming all the energy, all the blood, and all the nutrients that are required for the body as well, and growing exponentially in that particular area. So we identify using this small glitch in the pathology of having a tumor using a perfusion scan as well. So can it be treated? Like we discussed, benign and malignant have a different ways of getting it treated. Also, thanks to the advancement in the neurosurgical department, there is a lot of precision that has come into treating these things, because we cannot afford losing even an inch of a brain tissue while removing a tumor. So we have something called brain GPS, commonly called as neuro navigation, where we are very precise to the core to reach the main tissue of the brain tumor. Also, microsurgery with ultra fine precision, microscopic surgery, basically, endoscopic tumor removal, where you do not cut open the skull. We don't reach it from the top. We go from small holes in the face and the skull bone to reach that particular area, commonly done through nostrils. And gamma knife and cyber knife, which are very precise radiation equipment, they are non-surgical, no blood loss. So these are something which we have come up in the last few decades, which give much more benefit for the people who have tumor diagnosed, even at a later stages. And like we discussed, if the tumor is benign, we can actually remove it completely. And if it is malignant as well, we with this advancement we can remove it to the maximum microscopic extent possible with minimal damage of the normal surrounding tissue. It is not, today's surgery is not what it was 20 years ago. It is safer, smaller, and smarter. So, yes, your brain controls your thoughts, memories, emotions, dream, your identity, not just your movements and sensations. So, it deserves attention. So a simple MRI can make a huge difference between fear of maybe or may not be having a brain tumor versus no, I don't. So yes, early diagnosis is the only key to save life and the quality of life that you might live with once that part of the tissue is being involved. And recovery is usually excellent if identified and removed early on fully. So try to understand how brain tumor works. Most importantly, the early symptoms to be identified and recognize between the difference of a brain tumor versus a regular stroke, and hence take a proper neurological consultation or neurosurgical consultation to make sure that this is not what we are supposed to think about it. So early diagnosis is the best recovery from a brain tumor. Thank you.
It was a very informative and eye-opening session for all of us. Thank you to all participants for joining today's section. See you all in next section.